Welcome to Zonie Living. I'm Bonnie Stevens. Our topic today is America's mental health crisis. Our guest, internist and university professor, Dr. Robert Smith, has spent a career treating patients, training doctors, and researching mental health care. He says America's mental health care is in a deplorable state. We'll hear some heartbreaking stories, some shocking statistics, and learn what Dr. Robert Smith prescribes for healing our nation's mental health system. Hello, Dr. Smith.
Hi, Bonnie. How are you?
Good. It's great to have you here. I'm so happy that you can join us. And I wanted to mention that your book, Has Medicine Lost Its Mind? Why Our Mental Health System is Failing Us and What Should Be Done to Cure It, opens our eyes to what you describe as a mental health care crisis. You say doctors aren't trained to treat mental illnesses, and the same expertise that they apply to physical conditions like diabetes and heart disease is not applied to mental health illnesses. In fact, you say that only 25% of individuals with conditions like depression or substance abuse receive care, and most of that care is substandard. Can you help us understand what's happening? Why are symptoms of mental health often mistreated and missed altogether?
Yeah, it's a difficult problem and one that's largely not recognized. I think most people assume their mental health care is as good as their physical disease care. You know, they go to their primary care doctor or another medical doctor and assume that it's just as good. The problem is it isn't. And as you're saying, no more than 25% of all mental health patients, and there's more than 90 million people in the country with mental disorder, only 25% of those are getting any care. And the problem gets worse even from that.
That's frightening.
Of that 25%, 75% or more is provided by untrained medical care doctors like myself. I'm a primary care doctor, and people did not train us in mental health care. And yet, mental health care, as I said, there's about 90 million people with a mental disorder. It's more common than heart disease and cancer combined. It's the most common health condition in the U.S., and yet medicine is not training its graduates who provide 75% of all mental health care. They're not training them. Medicine provides no more than 2% of total training time. And Bonnie, this is over 4 years of medical school and 3 to 5 years of residency. No more than 2% of that total time is toward mental health, even though it's the most common health condition there is.
Boy.
And this is why, predictably, care is substandard. And it just is, it goes on. And the solution to this is so obvious. Train the doctors who provide the care. Now, you might ask, what about psychiatry? Aren't they supposed to do this? Psychiatrists see no more than 12% of all mental health patients. Psychologists see another 12% or so. That leaves the remaining 75% being cared for untrained primary care doctors like myself. And again, it's not these doctors' fault. They are not trained.
And I'm guessing the problem got worse with COVID, with the pandemic. Have we straightened out? Have we bounced back from that?
It has not, no. And it was already a crisis before COVID. Then COVID came along, and some estimates are as much as tripled the number of mental disorders. It tripled the amount of people considering suicide and seriously considering it. And COVID abated, but the mental health crisis has not. It's now worse than it was even before COVID. Quite frankly, it's just getting progressively worse.
Oh, startling.
And the idea that psychiatry was going to take care of this is just foolhardy, and it always has been. Medicine has known the psychiatry sees so few patients since the 1970s, but this is somehow what they have relied on. And right now, the number of psychiatrists is decreasing and the number of training programs is decreasing. So it's apt to become even worse.
Oh, my goodness. Well, in your book, you provide some really tragic examples of patients whose symptoms were misdiagnosed or simply ignored. Sven, a person that you described, was a man you met early in your career, and his case has stuck with you for decades. Can you talk about
Yeah,
Sven?
sure. He was name was Sven, Sven. He was Swedish. And he came in at just unbelievably high blood pressure. For people to understand numbers, it was the range of like 240 over 150. His eyes had been damaged from the blood pressure. His heart was enlarged. And he had what was known as malignant hypertension. It's just a severe form of hypertension. And back at that time, one that could not be controlled with the medications we have today. And he came in as a wonderful guy, funny guy. He's always saying, "Have you heard the one about?" And it'd be a little off-color joke and so on. And I was a resident at the time, and we would rotate for a month on a given service. And he was there on the service, and we couldn't control his blood pressure, and all the experts there were working on it. And so I then went off that service and then came back a month later. And at that time, he'd gone from this ebullient, effervescent, wonderful person. He was curled up in the corner of his bed, just almost in a fetal position. And clearly must have been depressed and down. He had lost all his money and his health care expenditures, and I'm sure was depressed. But nobody addressed this with him. People would come in and say, well, the blood pressure is a little bit better and so on, but his kidneys are worse. And he was failing. And long story short, he died after about 2.5 months in the hospital. And the striking thing about it, after he died, he always had, I remember, a bright colored toothpaste tube. It was called Vaddy Makem. And it was his toothpaste. It was always on his bedside stand. And I just remember it stood out. A couple of days after he died, I somehow stumbled on this word in Latin and translated it. It really grabbed me, and it said, "Go with me."
Oh,
We didn't go with him. We ignored his humanistic plight. We did all the right things, from blood pressure and kidneys and heart and so on. But when it came to his personal dimension, we didn't do anything. And I wondered about that at the time. And I could see it wasn't that the doctors, the faculty, and other residents, it wasn't that they didn't care. You could see the worry in their face. But we were taught at that time, don't get involved in people's emotional material. It will destroy your objectivity. Or another version of that might be, don't get involved with patients. It's intrusive in their personal life. Stay on the medical stuff. And so that was kind of it. And nobody addressed any of this thing with him. And the poor guy just suffered in isolation, in effect.
oh, that's
And it was terribly disturbing to me. And as I talked to other doctors about other patients and so on, they felt the same way. People
yeah.
were frustrated. We're human beings, but we're not doing anything human with this person. We're just giving medications and doing tests.
Yeah, there's another patient that really broke my heart. Her name was Joan. She had
Yeah.
cancer. She'd been through surgeries. Consequently, her vocal cords were affected. Her voice, you said, was really hard to listen to. She had an open wound at her throat that wouldn't heal and was unsightly. She didn't want to see anybody. She didn't want to continue on. To say she was depressed feels like an understatement. Knowing
Yeah.
what you know today, how would you go about treating a patient like Joan?
Yeah, I mean, one of the things, and this is the way Sven should have been treated also. And I was getting a little better by that time.
Mhm.
I was now in practice, and when I saw her, and again, she came in, and her husband had left her. She couldn't work.
Oh,
Um, she had this, it's like scraping your fingernails on a blackboard, raspy, unpleasant voice. And I worked with her over a number of months. And she basically, we tried antidepressants, everything on her, and nothing seemed to help. She finally was satisfied that nothing could be done, and eventually she just passed on away.
yeah.
But um, those kind of people, doctors need to understand that someone like that, you do more than just adjust their medications or their pain injections, or do tests on them. Sit there with them, hold their hand, be empathic. There is more to doctor-patient relationships and communication than being a nice guy.
Yeah,
Most doctors are nice, decent people,
sure.
but there are a set of complex skills that one has to learn to be able to effectively interact with patients. And we've written a textbook on this. We developed the only randomized controlled trial to show a specific evidence-based method that describes how to teach doctors to be empathic, to elicit emotions, and to be sensitive to their patients' needs. In fact, it's used throughout the US in medical schools now, the textbook. Um, and but it can be taught, and it takes several weeks, 6 to 8 weeks, working with someone to teach them this. This is not a matter of just being a nice guy. There are a set of complex skills that need to be taught, and that's what medicine is not doing very well.
Mm. Well, in your book, you also talk about the cause of poor mental health care, and you point out that patients suffering from everything from work stress to schizophrenia are often treated by family doctors. You were pointing this out earlier, internists, gynecologists, people not commonly trained in mental illnesses. Thus, psychiatrists, who you mentioned, are treating only 12% of the patients with mental health disorders, while other doctors and healthcare professionals are seeing the rest of those patients. And as you mentioned earlier in the program, that's a huge number. That's 90 million people who will experience one or more major mental disorders in any given year. So, what are
Yeah.
some of the resulting problems from the shortage of mental
No.
health care professionals? I'm thinking, a lot of people are going, well, maybe they'll just get better. They were just having a bad day, or their work
Yeah.
situation will change, or they'll make some improvements in their life. But it's a lot more complicated than that, isn't it?
Oh, it's a disaster. Um, The opioid epidemic is one example.
Mm.
There are over 200,000 deaths from doctor prescribed opioids since the opioid epidemic began. It's still in the range of 15,000 a year. These doctors are not trained in the use of opioids. They are not trained in chronic pain, which is why most of these opioids are given.
Mhm.
And so instead of addressing the personal dimensions, the being empathic with the chronic pain patient, they were told by drug makers like Purdue Pharma and the Sackler brothers, who happened to be doctors also, unfortunately, that these were safe and effective. It's not the doctor's fault. They were told this would work, and they had no training in it, and so they take the drug representative's advice. Another example, Bonnie, this is even worse. There are 48,000 suicides a year. Now, half of those are seen by the primary care doctor in the 2 to 4 weeks before they commit suicide. This is an ideal opportunity to prevent the suicide from taking place. But doctors aren't trained in suicide. They don't recognize it, and they don't know what to do with it if they do happen to recognize it.
Wow.
Now, we're talking here, Bonnie, tens of thousands of unnecessary deaths, largely preventable. Let's talk now about what happens from a disabling standpoint of the people with mental disorders who do not die. We're talking about depression, anxiety, substance abuse. Okay, when doctors do not recognize those and effectively treat them, there are unnecessary divorces, unnecessary job loss, school failure, addiction, homelessness, incarceration. Now, I'm not saying all of these can be prevented, but if the doctors recognized and effectively treated these problems, you could interdict much of that disabling downside that right today goes unrecognized. And there are thousands of unrecognized divorces, job loss, homelessness. The homeless and the incarcerated populations in the U.S., there's something like 70% of them have a major mental disorder, and it's not been recognized. If you recognize these things early and treat them, these bad things don't happen. And so this is the commonest health condition in the U.S., but doctors aren't trained, the doctors who provide the care. It's not their fault.
Well, you recognized this early on in your career, and patients like Sven and Joan led you to leave your practice, actually, and to acquire more education, more skills in being able to treat the mind. So you landed at the Los Angeles Center for the Healing Arts. How did that experience change you?
Yeah, no, I went, it was the first time that I had been exposed to people who valued the relationship, and they modeled it and helped teach some of it to me. It was the first time it had been kind of okay to relate to people, overcoming that kind of medical inertia that you're taught. And so I then went to the LA Center for the Healing Arts, and I was there a year, and I then went to the University of Rochester in upstate New York, where I took formal training, and this included psychiatry, counseling, doctor-patient relationships, and so on. I took a 2-year fellowship there, and then I was on faculty there until I went to Michigan State. And that's where I not only learned the value of the relationship, but how the details of it, the specific details that went into it, and how to conduct it, and in turn how to teach it, and then how to do the research on it.
Well, Dr. Smith, you've seen how patients' physical conditions improve when the mind is also treated, and how their pain is even lessened. Let's talk about that.
Yeah, people, we're talking so far, it sounds like medicine does not do a good job with mental health, and that is correct. Physical disease is medicine's forte, right?
Yes.
Well, even physical disease is jeopardized by failure to train in mental health, and here's why. 17% of all chronic physical disease patients, these are people with heart attacks, emphysema, diabetes, what have you, the worse those problems become, the more likely they are to become depressed. And 17%, that's some 30 million people in the US who have a chronic physical disease, have a co-occurring mental disorder. Okay? If you do not treat the mental disorder as well as the physical disorder itself does not get better. And that leads to inordinate costs. It costs 2 and 3 times as much to take care of a patient with a comorbid, co-occurring mental disorder as it does to just the physical disease when they don't have one. And it's been estimated you can save from $24 to $48 billion a year simply by treating this co-occurring mental disorder. But it's the primary care doctor who is treating these people, and they don't understand that. And just let me take a moment and say more about primary care doctors. They have worked very hard, many of them in practice, to acquire some skills that go with this, and learning about medications and relationships. And these people are not bad people. They're good doctors, and they've worked hard at it. The problem is you can't learn about mental health on a weekend conference or reading a book. It requires intensive, supervised by someone who knows what they're doing with real patients. In other words, you have to be supervised in your training with a suicidal patient or with a depressed patient. That's what medicine does with physical diseases. I was supervised taking care of people with, say, heart attacks and strokes. I probably was supervising 50 different patients where an expert was teaching me how to take care of them. That does not happen with mental health care. Now, medical schools, if you talk to them, they'll say, well, we teach suicide and we teach opioids, but it's just a lecture here and there. That's part of the 2% that they do. They do not provide supervised training in mental health problems. And so it is not the primary care doctor's fault.
Well, you do write about the many reasons why people can't seem to get help with mental health illnesses. And I also recognize that there is a stigma around the situation. People don't want to lose their jobs or their friends or their family members. And you talked about in your book a hidden curriculum. Can you share that?
Yeah, this is the doctor's stigma towards mental health problems. We not only are not taught about mental health, that's the 2% token training we receive. We're not only not taught about it, but the attitude of many faculty, other residents, and trainees is anti-psychiatry. That's a culture of medicine that has become ingrained. And in fact, most psychiatric hospitals where people train are so-called across the street. They're over there. You'll often hear people talk about, they'll say, well, the psychiatry patients are over across the street, and they will kind of chuckle and say, I think the psychiatrists are as crazy as some of the patients.
Sure, yeah.
There's this dismissal of psychiatry and of the psychological thing. This is where it comes from. Don't ask about patient emotions. It'll destroy your objectivity. And there was a study, Bonnie, in the British Journal of Psychiatry, I believe, several years ago. 49% of students entering medical school are very interested in psychiatry. By the time they graduate 4 years later, it's down to 4%.
Wow.
Something is happening to them in the 4 years. We are beating an interest in the psychological, social, and mental health aspects out of them. And some of that is the fact that all of that 4 years is devoted to physical illnesses. That's all we hear about. You don't hear about mental disorders. And so, but there's also this overriding negative culture of medicine.
Well, I wanted to also talk about the good doctors that want to help their patients. And it sounds like early on, it's easy to see how a young doctor could be trying to figure out this puzzle and not really thinking about the mental health connection. And yet, so they might prescribe a series of tests and more tests to try to uncover what the underlying cause is. Now, we all know how expensive more tests are. So at what point, where does the patient need to step in, or an advocate for the patient need to step in and say, let's slow this down a little bit and let's dig a little deeper or go in a different direction, because we're pretty sure it's not all these rare things that you're looking for. And yet that is what happens sometimes. The cost of medical care is expensive to find out some of these problems.
Oh, you've hit on a key problem, Bonnie. And most mental problems in primary care present with physical symptoms. They
Mm.
often don't come in and say, I feel depressed or I'm down. Instead, they come in with chronic pain. I can't work anymore. I can't visit my kids. Or they'll come in with fatigue or a whole host of physical problems which have them disabled. And it's the disabling aspect of this that leads to the depression and substance abuse and so on. And so, given that these people are coming in with physical complaints, this is what doctors have been trained in is
Hmm.
physical complaints.
They can grab
But
a
the
hold of
doc
that.
but the doctors interpret that as its physical complaint is a sign of physical disease. And so if the first test they run don't find the physical disease, they run another set and another and another. And this is where much of the cost is coming from in medical care, is that these unnecessary tests. If the doctor would simply say, gosh, it sounds like you can't work anymore, and you can't even visit your grandchildren, how does that make you feel? Do you feel depressed? Introduce the topic to the patient, then you can get on and treat it. And so that's a terrible problem from a pure cost standpoint.
Yes, and you were talking earlier in the program about just how expensive this is across the country every year. And you say that 40 to 50% of chronic diseases can be actually prevented by a
Yeah,
patient's psychosocially based lifestyle habits. And you mentioned some of those, but I think it helps to hear those again. What can we do that is making a dramatic change in our health, in our lives, and
sure.
also on a grand scale across the nation in costs?
Yeah. Just as a backdrop, medicine is not excluding just mental health. Medicine is excluding all psychological and social material. And again, there's a few token examples of it, but that's part of the 2%. And so, besides mental health, psychological and social issues are important in physical diseases. And here's how. What you mentioned as lifestyle factors are all psychologically and socially based. Eating too much, drinking too much, not exercising, overeating, and so on and so forth. It goes. Stress. All of these are psychosocial factors. Okay, your patient now comes in and they've got diabetes, but they're losing a toe on their foot from the diabetes, or they're having eye trouble. They've had a heart attack, maybe a stroke. Okay, doctors don't know how to address these psychosocial factors. Let's say this patient is smoking, they're not exercising, and they're overweight. Doctors, of course, say, well, you need to quit smoking and you should lose weight and try to get some exercise. But that doesn't cut it. These are highly complicated motivational interviewing skills that are required to get people to, quite frankly, do something they don't want to do.
Hmm.
Who wants to quit smoking? Who wants to not eat as much as they'd like? And so these skills, it's just like interactional skills and doctor-patient relationship, take extensive training, and doctors are not taught those. And so they just give the perfunctory, you should stop smoking and get exercise, and nothing happens.
Yeah.
Now, Bonnie, it gets worse on these lifestyle factors. We've just described a patient, say, with diabetes and a heart attack and some eye trouble from it. We know that we can prevent 80% of all heart attacks, strokes, and diabetes by controlling these very lifestyle factors. But that would entail, instead of this person retiring at 65 with a stroke, diabetes, and eye problems, taking them back in their teens and 20s so that they never start smoking and they never start not exercising and so on, and controlling all of these, you could prevent 80% of these problems. Now, here's where the massive savings financially come into society. Our estimated expenditures for this year, I just read, are now up to $5.6 trillion in healthcare expenditures this year. Most of that expenditure is on chronic physical diseases. I said you could prevent 80% of the.
Wow.
What if you presented half of them? Half of $5 to $6 trillion is $2 to $3 trillion a year.
Yeah.
This money could be saved, but medicine doesn't do that. It waits 25 or 30 years until the disease occurs and then treats it. And even then, it overlooks the psychosocially based lifestyle factors. And so this is a tremendous reason why politicians need to get involved. If you save $2 to $3 trillion a year, that's $20 to $30 trillion over 10 years. This is how you meaningfully address the budget deficit.
Yeah, and what we could do with that money and how many lives saved or lengthened or quality of life improved. You know, it is mind-boggling. There was a statistic that was also mind-boggling that I read in your book, and it said in 2013, 249 million opioid prescriptions were written by doctors. And you put that in perspective by saying that's enough for every adult to have their own bottle. This blows my mind. I'm very close to this kind of story because I was very close to a woman who at a very young age, 20 or 21, when she had her son, she had what the doctors used to call baby blues. And this started her off on a road of addiction. And so soon she was being prescribed for her moods, for not being able to sleep, for a way to calm herself down or a way to deal with pain, which I understand creates more pain. And at the end of her life, she lived miraculously to 64. But at the end of the life, she had pretty much lost every friend she ever had. Family members had abandoned her. Yeah. She was basically shamed and shunned by everyone around her for calling, and I learned a new word when she was going through all this. She was called a seeker, which, as you know, is someone who seeks more drugs. And it becomes difficult to tear apart the difference between what's the personality and what's the addiction. And yet to punish this person for seeking help when she was 20 or 21 seems incredibly cruel to me. Now, there has to be a better way to do this. So with inadequately trained medical doctors and the shame and stigma that goes along with a lot of mismanaged, let's say, prescriptions, how do we recognize and do this as a nation? How do we treat the mind and continue to help people and see the brighter side of what we can do with trillions of dollars?
Well, first off, I'm sorry to hear you had to experience that personally. That's difficult, not just for the person involved, but for the friends of the person.
Sure.
So thank you for sharing it. I mean, that's just a terrible problem you've described. It's untrained doctors treating something for people who do not have a physical disease, but they're assuming there must be one there. And so they treat them. The patient then becomes addicted, and then they get more medications. But doctors also now, and this is rampant right now, Bonnie, all of these people that are now getting opioids over the past 20 years, the ones who did not die from an overdose are now around and addicted, just like your friend was.
Yeah.
Doctors are not trained in addiction. Not only are they not trained in opioids, they're not trained in addiction. And so they've got these people now taking, 5 or 6 of the Vicodin or whatever the narcotic they take is a day. And doctors don't know what to do with it. They're not trained in it. And so this is just one example of how profoundly impactful this lack of training is. And quite frankly, medicine, and I'm talking about organized medicine and medical education, not your primary care doctors, but organized medicine, medical education, has been hearing about this problem, lack of mental health training, lack of prevention, lack of lifestyle, addressing lifestyle factors, since the 1970s.
Mm-hmm. Wow.
They have done next to nothing. And in fairness, they have addressed interviewing that we were talking about. And most schools now teach that. So there is some hope within medicine, but it's not much when this has been going on. There have been warnings of this. This is over 50 years. They've been hearing this since the 1970s.
Yeah.
You've got to do something about this. You need to train doctors in lifestyle factors and mental health intensively in all years of medical education and in residencies. People have been saying that. I can show you articles from the 1970s, but medicine does not do it. And so I have concluded, and this is quite frankly why I wrote this book, Has Medicine Lost Its Mind? I've decided we need to go to the public. The public needs to hear about what's going on and how poor their mental health care is, but also how resistant medicine is to changing. I mean, the way we're going now, we'll be having the same conversation 50 years from now.
Oh, boy.
There's no prospect medicine is going to change. And so the public needs to take over, and there needs to be a federal board of some sort. Don Berwick has talked about it being analogous to the Federal Reserve, which controls banking, as you all know. And so a group like that, it would be independent of all politics. It would be balanced politically. People would be assigned staggering rotations on the board, and it would control all medicine. It would decide what is taught, what is practiced, and what is researched. And this, quite frankly, is what needs to happen. Don Berwick called it a health system accountability board. I called it in the book, it's in one of the appendices there, National Institute for Mental Health or for Health Education. But whatever it is, there needs to be some supraordinate structure. Medicine has always been very insular, and it runs itself basically, and with very little input. And what is happening now is what Susan, or what the people have warned about in letting professions, sciences go unchecked. The public must always run the direction of a science. And we've decided this. We're not going to have test tube babies. The public weighed in on that.
Yes.
AI is not going to run us. We are going to run AI. The public has weighed in on that, okay?
Yeah.
The public has never weighed in on what they want from medicine. And this is what we see today, what you and I are talking about, is a classic example of what happens when the public does not weigh in. Medicine has gone off the tracks.
Well, you know,
as you're hearing today, it has done a great job with physical disease for the most part, but mental health is a disaster.
Yes, I was just going to mention, as you point out in your book, just, you know, when we get behind, when we have this momentum and we all get behind something awful like cancer and look for a cure, I mean, the prognosis for cancer patients is not death anymore. And same thing with AIDS and other diseases. We can create that energy to go after it. And we've proven that in the past many, many times. Your book is also fascinating about the history that you chronicle. The History
Yeah.
of Modern Medicine, to explain how we arrived at this point. And I love that you bring in the physician Hippocrates, which of course is named for the Hippocratic Oath, or the other way around. And so tell me what he was saying, and then what happened through the centuries.
Yeah, yeah, no, this is this is fascinating. It's interesting. I hope people will read it in the book just for this.
Yes.
So let me set the stage here. Medicine is failing to train its doctors who provide 75% of all care for the commonest health condition medicine has. Okay? How could such a crazy thing happen? Has medicine lost its mind? That's how I come up with the title of the book. How could medicine do this? It seems so incongruous. Well, let's go back now to Hippocrates. From Hippocrates, this is in the 5th century BC. This is 2.5 millennia ago. The mind and body were always seen as related. They would describe melancholia and
That's right.
and biliary colic at the same time. Doctors saw all of this running together, and this was the situation up until the 16th and 17th century scientific revolution. Mind and body always went together. Well, come the 16th century, and this was when all of science, not just medicine, was coming out of the dark ages. For 1,000 years, the church had run everything with an iron hand. But medicine was now starting to get traction, as were other sciences, and they're wanting to improve and correct the problems of the previous dark ages. And so in medicine, the basic science was human anatomy. And you'd think that required dissection of the human body.
Sure.
But the church had prohibited it.
Wow.
And so medicine, or doctors back then, dissected goats, cows, pigs, and inferred that humans must be like that, which of course erroneous.
Oh boy.
And
Four
so
stomachs.
yeah.
Wow.
Yeah, 4 stomachs. And so in 1537, Pope Clement allowed dissections of the human body for teaching purposes by physicians. But he had one proviso. The head must first be decapitated and turned over to church authorities for proper burial. It was the source of the mind, the soul, and the spirit. That was to remain the church's province. So medicine got the neck on down the rest of the body. And that started the mind-body split. And so anatomists and subsequent physiologists focused just on physical body things and left the mind alone. But the major influence came in the next century with Descartes, who everybody has heard of. And he's the one who established philosophically the mind-body split. And in some sense, in some quarters, you will hear people with a little more jaundiced view of it and said it was simply a political compromise with the church. The church was all powerful, but science was picking up. And so what Descartes said was, what is in my mind is untouchable. You can't nobody outside me can evaluate it. Only I know in here. Whereas they could feel my shoulder or my arm and examine it objectively. And so the body was different from this mind. And the mind was then what went to the church. The physical body stayed with medicine. And it's been that way ever since then. It translated into clinical medicine in the mid-1700s and really didn't come to fruition until the last century, when a bunch of discoveries, penicillin, ether, chloroform, all were discovered. And then all the advances of last century, control of smallpox, polio, organ transplants, MRIs, genomes, and everything, all of these
so much
came.
Yeah.
And so but it was all focused on the physical body. And that was the mind-body split. Mental health was still ignored, but all these advances in the physical body were dramatic. This mind-body split did work. Life survival doubled from 1900 to 40 years of age to nearly 80 in the year 2000. That is a dramatic improvement.
Yeah.
That's the only meaningful therapeutic advance of medicine from the time of Hippocrates, and it all occurred in the last century. So we cannot be too critical of medicine and its focus on physical disease and excluding mental health. And the way I like to think about it is that medicine is now evolving, but it's going to need to be guided by the public. And the public has got to get involved and now encourage medicine to broaden its scope, in which case things will get even better.
So what's our next steps? Do we write our Congress people? What is the next? Give us some easy tips that people can do.
Yeah, it's easy to talk about these things in general, and everybody kind of agrees it's an awful situation, and then they go on and have a piece of pumpkin pie or something, you know. But here's something everybody can do. Go to my website. It's robertcsmithmd.com. Don't forget the MD. There's too many Robert Smiths otherwise. So robertcsmithmd.com. When you click on that, one click down is a little square that says Act Now. Click on that. Up will come the email addresses of the President, the Surgeon General, the National Academy of Medicine, your congressperson, and your senators. Now, go down a little bit, and there is a sample letter that is requesting what we're talking about today, a federal board to take over and advise medicine what it needs to do. Paste that into each of the emails and send it. This is the way an individual like you can have an impact right now. The public has got to become involved, and our politicians need to hear about it.
Well, Dr. Smith, you've made it so easy for you. Thank you for all the work, for your research, your hard work, your compassion for patients, and for sharing your insights with us. And of course, your optimism that we can be a better, stronger nation and healthier people as a result. So thank you so much for writing your book, Has Medicine Lost Its Mind, and for being with us and spending time with us today.
Thank you, Bonnie. I've enjoyed talking with you.
This has been fun. Thank you so much. Dr. Robert Smith is a university distinguished professor at Michigan State University and a pioneer in patient-centered communication and primary care mental health. His book, Has Medicine Lost Its Mind? Why Our Mental Health System is Failing Us and What Should Be Done to Cure It, has been described as a groundbreaking examination of America's mental health crisis. It is available on Amazon. And I'll leave you today with some of my biggest takeaways from our conversation with Dr. Robert Smith. Again, 1 in 4 Americans suffer from mental illness, yet 75% receive no treatment at all. His book expresses the tragic human suffering and the billions and even trillions of dollars spent in the United States that could be saved by treating the mind and body and by seriously addressing unhealthy habits. This is Zonie Living, Business, Adventure, and Leadership. I'm Bonnie Stevens.